All right, so we are live and we are waiting for our host, our panelist, to come in and join us from Insulin for Life. So my name is Carrie Sparling. I am CWD's editorial director, and like real life diabetes sort of stuff, I'm having an awful low blood sugar right now. So I had to call Jeff Hitchcock on the fly and ask him if he could come and cover for me for just like 5 or 10 minutes while I eat fruit snacks and sweat. So I'm going to be promoting Carol to panelist right now. So she should be joining us, and I'm going to sit here and eat, and Jeff's going to talk. Thanks, Jeff.
Anytime, Carrie. So we don't see Carol yet. Is she? Ah, there she is. Carol, good to see you. You should unmute.
I'm unmuted.
Great. So let me do a very brief introduction. I have known Carol and her husband, Mark, for years and really appreciate the work that they do with the Insulin for Life USA project. For those of you who aren't familiar with that, it's an organization that provides insulin and diabetes management supplies free of charge to those with diabetes who otherwise would go without these very important medicines and the like. And they work out of Florida, where both Carol and Mark live. And we wanted to invite them to do a Screenside Chat with us so that they could share the incredible work that they do so that our CWD family would get to learn about it. So with that, Carol, I'm going to stop my video and mute and let you take over and share the story of Insulin for Life.
Perfect. Well, hopefully this will work. I'm going to, can I share my screen?
You should be able to. Let me, yep, you can share.
Perfect. Let's get here and see if I can do the presenter's view.
Looks good. I'm going to sign off video and mute. And Carol, the floor is yours.
Perfect. Well, thank you so much, Jeff and Carrie, for this opportunity. We are always grateful to, there we should be getting my screens to come up. Always grateful to share the message of Insulin for Life with those who want to hear about it. And we know the CWD family is an amazingly active community. So what a great opportunity for us to share. Jeff already kind of gave a summary of what we do. Unfortunately, Mark is not meeting us today, so you just got me, but I am certainly happy to be here. So Insulin for Life is located in Gainesville, Florida. We have been actively working in Florida since 2012 and gratefully have seen amazing growth and success in what we're doing. And that is only possible by people within the diabetes community really coming alongside and making our work possible. I would love to show you a little bit about what we do and then answer any questions that you may have, because I'm sure I'll leave a lot unsaid. So what we do collect in-date unopened supplies from individuals and organizations all around the United States. We carefully inspect them. We refrigerate the insulin. We just make sure that everything is ready to be redistributed to our partners. And we house that and do receive those all here in Florida. You may ask how to send those in. I'm trying to anticipate questions that you may have along. We do have on our website, thankfully, a packing video and written packing tips about how to safely protect that insulin during shipping. We all know insulin has a very tight window of temperature control that it needs to be at. So that's all on the website. I'm grateful to say we have a wonderful staff here also that receives calls and answers questions on an individual basis and can really walk you through that process. The key elements to keep in mind is we cannot accept anything that's expired. People often can be surprised when they learn lancets, syringes, pen needles. The far majority of all of these items do come with a manufacturer's expiration date on them. And we're often asked, if you don't have anything, wouldn't an expired lancet or an expired syringe be better than nothing? And unfortunately, that's not up to our interpretation. Our drug license absolutely precludes us from having anything in our facility that's expired. So it's a hard line, but we have to certainly look at that. So we encourage everyone to look carefully at their items before they go to the wonderful effort to send things in. And we're talking about that manufacturer's expiration date, not the expiration date of the prescription, which can be very, very different. The next question, I think, if I were sitting in your seat, would be, well, what do you do with these supplies? Where do they go? We have two main branches of what we do. The first being our international partners. We are currently located in 18 countries, and you'll see them written there. But for those who maybe are just listening and not looking, we are working currently in Barbados, Belize, the Cayman Islands, Central African Republic, Dominican Republic, the Gambia, Ghana, Guyana, Haiti, Jamaica, Liberia, Nicaragua, Nigeria, Republic of the Congo, Rwanda, South Sudan, Togo, and Uganda. Several of those countries we actually have multiple partners in. For example, Liberia, we're currently working in 3 clinics and actually providing supplies also to the Ministry of Health. So those are 18 countries, but they do represent multiple locations. The other arm of our operations is disaster response, and that could be domestically or internationally. And all of our work, I want to jump in and say, is with partnerships with healthcare professionals. We do not provide supplies to individuals, one-on-one individuals, because as all of us in this talk understand, diabetes and insulin therapy and managing diabetes is best done with a healthcare team. So we want to be sure to encourage people to stay in that good relationship with their healthcare team. And the way we do that is legally, we're not allowed to dispense medication anyway. We do that directly through a licensed healthcare provider. And that also strengthens that bond between the healthcare team, the person with diabetes, and their loved ones. So that is how we work. A little bit about our disaster response. I am going to lump COVID into, I know that's a pandemic, and often when we talk about disaster response, we're talking about hurricanes, earthquakes, wildfires, tornadoes, those kind of natural disasters. But COVID activities and the COVID pandemic really gave Insulin for Life an opportunity to make a huge impact within the United States. If you're looking at the slides, you can see our map there. We started out first in response to the FDA temporary allowance for the CGM sensors to assist people who were hospitalized. And that didn't mean they necessarily had to have COVID, but were in the hospital for any reason. Back, if you remember at the beginning of the pandemic, PPE protection gear to protect the inpatients as well as the hospital personnel were at real low and very difficult to get, and people were not able to monitor their blood sugar in a safe level. So that's when the FDA stepped in and allowed CGM in a inpatient setting. We had some sponsors who came and provided 25,000 CGM sensors for us to distribute to healthcare, to hospitals. You'll see them on the map. They were all over the United States. We actually served about 119 hospitals with multiple shipments of sensors to utilize on people who were in the hospital. Right on the heels of that, we started working with healthcare clinics also throughout the United States. And you'll see on this map, it said served 47 clinics. I think we're up to 70 now. We're at the tail end of that project, but helping people retain the therapy that they were used to having. That would mean we provided actually 30,000 CGM sensors, along with some readers, test strips, meters, supplemental pump supplies. Again, people who maybe had a change in their healthcare coverage and were on these therapies and successfully managing their diabetes. And again, sponsors came alongside and wanted to keep people in the therapy that they were accustomed to and not let perhaps a temporary or maybe in some cases permanent loss of insurance and income to continue on that therapy to interrupt. So Insulin for Life came through and provided support in that way. Again, partnering with the healthcare teams, whether that was in the hospital setting or the clinic setting, to make sure these supplies were given free of charge to people in need, but they were also still receiving their education and their support from their healthcare team to keep them safe while life was otherwise chaotic. And that brings me to disasters. Actually, in the fall of 2017, Insulin for Life was one of 3 founding member organizations to come together and say, people with diabetes tend to fall through the cracks sometimes when a disaster strikes domestically. This is a total domestic focused group. That coalition is still active. It's called the Diabetes Disaster Response Coalition. I really encourage you to get to know this organization. Insulin for Life, as I say, I co-chair that coalition still to this day. CWD is one of the newer members of the coalition, and our goal is to come together, have a united voice during times of disaster domestically, to help keep people connected to resources, whether that would be pointing them to pharmacies that are open and active in the area. Occasionally it's Insulin for Life, wearing our Insulin for Life hat as a member of the DDRC, providing supplies. But what I want to say on this call, since we are so close to June 1st, which does kick off Atlantic hurricane season, you'll notice last weekend, maybe many of you saw Tropical Storm Anna, I think was the name, brewing up. Sometimes these storms don't understand that the season doesn't kick off until June 1st, and they want to make sure we're paying attention to them ahead of time. The prediction is for another above average season, and that's also not including the wildfires, which unfortunately have become such a tremendous problem. We've noticed disasters can be that equalizer and separate people from their supplies. We all know those with insulin-dependent diabetes can't take a break from their insulin. And there are questions, maybe I've lost power, how long is my insulin safe? All of that's addressed on the DDRC website. We actually have a downloadable preparation kit that I would so strongly urge everyone to look at and formalize your family's emergency plan. If we've learned something in these years of disaster response, it's each individual is the best advocate for what they need and when they need it in their diabetes management therapy. That would come into play into other illnesses and challenges that people face. So we really encourage you, way ahead of the storm, not when a state of emergency is declared in your area, but way ahead, download that information. Make sure you have all of the things listed in there that can be grabbed in a moment's notice, and it can be your go bag. So a little plug there for be prepared. My son was actually a scout, so being prepared is a big part of Scout family. I think it should be a part of a diabetes community as well when it comes to disasters and such. Again, I don't want to dwell on this screen or this slide presentation too long. I'd rather take questions and have some live chatting with you, but I hope that you're sitting there saying, well, how can I help? What an exciting thing. So we'd encourage you to discuss our program with your healthcare team about the opportunity to donate in-date supplies. We do have a drug license, which makes it legal for you to donate to us for the need and for the purpose of redistribution to licensed healthcare providers. Help spread the word on social media, support groups, blogs, community, maybe presenting to your healthcare team if they wanted to post some information. Don't post things around without permission, of course, but that displaying flyers, posters, postcards, wherever your community may see them. And then help in your community volunteering time, maybe helping people pack supplies for those who can't get out and about and would have trouble in those ways. Those are some of the ways right off the top of our head that we know you can, I would say, volunteer to help Insulin for Life as we try to help your community and the international diabetes community at large. And last, we'd encourage you to keep in touch. We do have a website. We're active on Facebook, Instagram, Twitter, YouTube, LinkedIn. Nowadays, there's many, many ways to stay in touch. We would love for you to stay in touch with us and maybe touch base and find out what we need, what you may have access, and how you can be part of our family. So I have gone through the slides. I'm going to open that back up. Hopefully Carrie or Jeff will pop back in and we can take this conversation wherever you all would like to with that brief summary of what we do and how you too can be part of this important work.
Well, Carol, just making sure I'm off mute. Thank you very much for your presentation, for joining us on this Tuesday morning instead of our Sunday where we tried to do this, but it didn't work. But I'm glad we were able to circle back and make this discussion happen. And also for your patience as I worked through my low blood sugar while you were giving your presentation.
Well, I hope you're feeling better.
I'm completely fine, but I felt really bad that I had to text Jeff really quickly and say, can you please jump in really quickly? Because I need some help. So all good now. You'll hear my high alarm in about 2 seconds, I'm sure. All good. But now that we've walked through your presentation, I really do appreciate that. The first thing that I wanted to jump in and ask about was the stuff that you guys actually need now. So let's see. For the things that you would be in need of your organization, what kinds of insulins are you looking for the most? And also I want to make sure that I get to the ways that people can make the donations, because one of the questions that I have for you is that you have this shipping label linked from your website. So can we talk through what you would need and then how people can kind of fulfill that for you?
Perfect. So let me answer your first question. I'll try and keep things in order. So we accept all types of insulin. There's none that we don't accept. And those that I may call insulin that others don't, maybe more directed at type 2, we also accept those. The things to keep in mind is we can only accept products which have been maintained in refrigeration. And we really encourage our donors, keep it in the refrigerator until you're truly ready to go and take it to the shipping carrier of your choice. And then on our website, as I alluded to, we do have a packing tips that talk about using a reusable, frozen, long-lasting gel pack. And sometimes when you see them, you're like, oh, now I know what she's talking about. What a crazy thing to say, a frozen gel pack. Not ice cubes thrown in a Ziploc bag. That doesn't work so well. We need these things that are designed for long-term reusable. And then the frozen pack and the insulin product would go together inside of an insulated bag or a styrofoam cooler. The size that best fits. We don't want a lot of extra space that reduces the effectiveness of the cooling and also increases the shipping cost. And if insulin is included in that shipment, we really encourage people to only send that on a Monday or Tuesday so that it gets all the way through the system, sending that a second 2-day or 3-day shipping, not over a weekend, because sometimes things slow down over the weekend. Now it seems like things ship, but everything goes slower on the weekend. So if you ship on a Monday or Tuesday, if that includes insulin, that is the very best plan. It's going to get here before the weekend comes. If you include that shipping label, you'll see there's a opportunity to include your email address, not so that we can spam you, but so that we can drop you an email and say your package arrived, everything looked terrific. That's important. You want to know it got to the other side, right?
Mm-hmm.
That's also how we offer the opportunity to receive a donation receipt. We are a 501c3 organization that is eligible to be a tax-deductible gift. So we do give the opportunity to send a receipt to take advantage of that. So that's in there. The minute that package is received at our office, we put the insulin right back in our refrigerator and let it rest until get up to a great temperature. So it's all very heavily regulated, and why we do that on the weekends.
That, and the bit about mailing on a Monday or Tuesday is a really good tip, because that's something that I hadn't considered at all. So thank you for including that.
Sure.
So on your website, you have, I know we're talking about Insulin for Life and insulin as a donated item, but you have a whole list of things on the site that people can donate. I'm seeing there were ketone sticks, glucose meters, at-home A1C tests. We've got some questions from the audience about accepting pills for people with type 2 diabetes or Freestyle Libre sensors. So could you walk through maybe some of the specifics of what you're looking for too, outside of insulin?
Perfect. Excellent. So starting out, we don't take any oral medications for type 2, people with type 2 diabetes. We just don't work with the oral medication. So we are so grateful for that offer, but cannot accept that. That's not part of the items we're authorized to receive. We do accept the Libre sensors, the Dexcom sensors, Omnipods, and all of that is kind of displayed on our website. So please feel free to check back. I know it's a lot of information to take in at once. Again, the important thing is it has to all be within date and actually have time for it to get here and then be redistributed and back out into people's hands so that it doesn't expire. So we give a good rule of thumb to be 90 days, 60 days at the very shortest. And let me say, we do also accept test strips. And that's something that we're really feeling the crunch on, as CGM is becoming so much more popular here in the United States, and we're so grateful for that. Our international efforts, not to be discouraging, but many of our people still don't even have the ability to test once a day with a test strip at home. They don't own a glucose meter. They're trying to do insulin therapy with absolutely no way to know what their blood sugar is, which is just sad. So test strip donations are down. So just a reminder, if you have test strips and maybe you're just getting in on CGM and saying, well, I want to hold on to these strips just in case I need them. I want you to be safe and do what you have to do for you, but let's not leave them sit around until they're expired and you throw them in the trash. So we would just say, think really carefully about what you can conceivably use and what maybe you can share with others who don't have that opportunity. And we can, again, always take a phone call here and answer any questions that you have. But so those are, hopefully I got all of your questions, and what I forgot, just jump back in. We do also take pump supplies, not actual insulin pumps, but the supplies, the reservoirs, the cartridges, the infusion sets, again, so that people who are on insulin therapy, pump therapy, and maybe have a change in circumstances, a temporary change, don't have to get off of that therapy. We know if you're already getting stressful things in life, changing therapy is not a good time for that to happen. So we try and come alongside, and that's really what's kicked off in a big way since the whole COVID pandemic, is initiating new partnerships with domestic clinics to help people retain a therapy that they've already been grateful to receive.
Oh, absolutely. And then that kind of spins me into a question I had about, we're talking about people who are able to donate and who can provide resources for others. But what if you're a person who is in need of resources and who's looking for ways to gain access to the supplies that they're either struggling to get their hands on or are really in dire need for something like insulin? How do those people find the places where your donations are going?
Perfect. So we always say to people, call and we'll try and help you walk it through it. There's a website that was launched, getinsulin.org, by the BT1 organization. That is an excellent tool to step-by-step put in, what do you take? What do you need? Is this an urgent need? Is it, and we help walk people through that. As I alluded to earlier, I can't emphasize enough, we are not authorized to work with individuals for what may be obvious reasons, but sometimes doesn't feel obvious when you're in need. So it's not that we don't want to, we're just not licensed to do that. And we don't have the educational element to assure that people are safe when they have questions to have answered. And we know, and for the same reason, we don't say, hey, we sent supplies to X clinic, go to them. We never know if they're accepting new patients. So oftentimes if people reach out to us, we can try and reach out to a clinic and say, hey, is there any chance you can help this person? Trying to keep everyone's privacy safe and not make a run on somewhere that's not accepting new people.
Mhm.
But again, if it's an urgent need, and we do have people call who are in desperate situations, the first thing we'll say, if this is life threatening, please hang up and call 911. We're not set up to help you at this moment, but we want you to get help. There have been people who don't have computer access and can't get to, and I've sat on the phone and say, if you don't mind giving me your personal information, I'll pretend I'm you and walk through this with you. But my bottom line is, please communicate to your healthcare team. Make sure that they know, you don't have supplies, you need help, and let them help you in your local area. We're in Florida and people are all across the country. So the best place to get help is your healthcare provider, and let them know what you're struggling with and get resources to your local community.
And how about for people who are looking to volunteer with your organization? I mean, sending supplies is one thing, but you just mentioned being on a phone call with somebody, helping them walk through a computer form. That's a lot for one person to do multiple times a day. So what about people who might have some bandwidth to give you guys some assistance?
And that would be a great thing. If you have something, we've had people volunteer and say, I'm not a healthcare provider, but I'm a whiz with technology. I'm great with graphics and design and fill in the blank. We've had people say, if there's anyone in my area that needs help packing supplies and driving it to drop it off, I can help. So we have a contact form on our website. Send an email to our staff and we'll get back with you and say, what do you envision doing? I can't say enough about sharing about our program. It breaks my heart that, and now the calls are so much less often. When we first started, no one knew who we were, what we were doing, where we were doing it from. Thankfully, that has changed, but spreading the word, maybe you personally don't have supplies to donate, but someone in your social sphere, your chat group, your Facebook group, your whatever, get that out there. We've had people share with their pharmacists. The kind of surprising thing is, if you're at a pharmacy and you had a prescription change and you got your prescription filled and then got in your car, never even left the parking lot and said, oh, this is my old prescription, and dashed back into the pharmacy, they can't take that back from you. That will be destroyed, thrown in the trash. Please stop, reach out to us and let us do that. So make sure your pharmacist is aware. Hey, have you ever heard of Insulin for Life? Make sure your healthcare team is aware. Anywhere that may have excess supplies. And we all know that have been in insulin therapy, there are a lot of reasons you can have excess therapy changes. You name it, that can happen. So anywhere that who is in connection with supplies, just reach out, make sure they know about. You don't have to throw these items away. No one who has these resources wants to throw them away, but sometimes it's just finding somewhere you can donate them to, or someone who can accept them legally, not doing something illegally. That's exciting, not sharing it with somebody else. That's kind of not allowed. So those are the times, and that may sound like, well, that's not really volunteering. Believe me, that's volunteering.
Completely understood. I hadn't understood that about the pharmacist. So that's a really good tip as well. And we had somebody in the chat ask that they said that they host a local support group, and they were asking if there's anything they can download to share with the people who come to their meeting.
So I would hope that you can jump into iflusa.org as our website. That was on our slides, so I guess you could rewind into this, but IFL, like Insulin for Life. I say it so quick, the F could sound like who knows what. So iflusa.org is our website. If you go at how can I help, what can I do, what do you need, all kinds of resources there, maybe even just sharing the web address or downloading a shipping form or packing tips guide and sharing it at your meeting would be immensely helpful. Thank you.
And I actually put the website in the chat window so that anybody who's out there and listening, they can click on that and go to your website. And also just a reminder to people who are attending at home that you can pop your questions into either the Q&A feature or just stick them in the chat. Either way, we'll see them and address them. And Carol,
Perfect.
one thing that I was remiss in asking at the beginning, because I was super duper low, was a quick walkthrough on why Insulin for Life was established and what's the story behind the creation there, because even in looking at your website, I saw lots about the people and the mission, but not so much the origin story. So I wanted to ask a bit about that.
Yeah, so Insulin for Life actually started in Australia about 15 years ago. A gentleman who has diabetes did a lot of traveling in under-resourced areas. And as he traveled, his thought occurred to him, wow, had I been born here, I wouldn't be, I wouldn't have therapy. What would life be like? And then he began to, and during his travels, realize from time to time, I have excess supplies and I don't know what to do with them. What if I could take my supplies and give them to someone who has no access? And that was really how the whole theory and project became developed. There is an Insulin for Life chapter in 7, 8 countries. I'm always trying to remember, and please don't ask me to list them all because I always forget someone and then I hurt someone's feelings. So we won't go there. But Insulin for Life USA actually started in Oklahoma from someone from Australia on their board who had a dual appointment and worked in Oklahoma University for a while. She was going back and thought, well, this is kind of taking off a little bit, and met Mark and I and said, would you be interested in taking over Insulin for Life USA? And actually at first I said, no, I don't have time for that. Thankfully, someone came forward and said, hey, we'll help you get it started. I said, all right, I'll get it started and then pass it off. That was 2012. And here I am sitting in 2021, still building. I haven't found a way to pass it off. I have a real passion for this work. I'll say that Mark, my husband, Mark, is in diabetes research. His whole career has been a goal to help people with diabetes study the disease. And it kind of felt like my part to do this. So in days when maybe the research is hard, he can enjoy what we're doing and making a difference every day. And it works out really well for us to share this diabetes connection and come at it from very different angles. Mm-hmm. We have a great team here at Insulin for Life USA in Gainesville. We have people who answer your phone calls, answer your emails, receive your donations. Some of our favorite work is, of course, packing these outbound shipments. I like to talk about them as diabetes care in a box. And some of our partners, will send me a picture. It arrived today, and we celebrate with them. Imagine being a healthcare provider and people in need of these resources and having no avenue. And then in comes a box with everything you need. So it's an amazing opportunity to really make a difference, both here domestically, because we know people need things here as well, and internationally. I say we get to connect the dots of excess and need. We're the luckiest people around, to be able to take those two things and put them together. And, we'll have people say, I have test strips, but my meter broke, or I have a meter, but no test strips, or I have syringes, but no insulin, and we say, it is amazing. We see all of this come in, and it always fills the needs, everything put together. Isn't that how community works?
Mm-hmm.
We all have what we have to offer, and we put it together, and it just is an amazing gift.
I can hear the pride in your voice. And that was actually another question that I wanted to ask you about, because in your bio on the website, you mentioned that one of your proudest moments was in the organization was in September of 2017, dealing with Wharton, Texas. Could you tell the folks who are listening a little bit about that? And actually, I was wondering if that's where the DDRC was born from.
So the DDRC is kind of a fun story. As I alluded to, Mark has been working in diabetes for years, and as such has a very close relationship with the American Diabetes Association and the JDRF, and the leadership at the time there in the fall of 2017, as we watched Hurricane Harvey, barreling toward Texas. Actually, the leadership at the time, Derek Rapp and Will Cefalu, started a text thread. That's kind of a fun story with Mark. And then Mark joined me in and saying, what about all the people with diabetes who are going to be caught there? What's Insulin for Life doing, was what they said. And we took a bold step and said nothing unless we do it together, which maybe wasn't true. We were going to do something, but hey, it created pressure, and they said, we're in. And out of that, the DDRC was born. We started Insulin for Life, sent 5 pallets of stuff before the storm even ended. And so out of that weekend, it was the Wharton, Texas situation happened on Labor Day weekend. And we had already sent a lot of stuff to Texas and got a call. I think at that point I was putting my cell phone out on the line. Not a great plan now, but we do have a number for the hotline. And somebody in Wharton said, we're I think their tagline for the city is Gateway to the Gulf. Well, the gate opened and the town flooded, and they were kind of off the beaten path and feeling overlooked. I don't know if they were or not. I'm not trying to disparage any disaster responders, but they weren't getting their needs met. And was a large population of people with insulin dependent diabetes who received their prescriptions through the mail. And I think you're guessing, it was that time for all of these packages to arrive, and everything was shut down for the storm. And as boats were going to find people were desperate. They'd been without their insulin. And so I got this call, hey, we need insulin now. And my thought was, it's Labor Day weekend, nobody's running. And I started calling the airlines and commercial airlines. I didn't know you had to be, had to have security. They had to inspect you and know who you were. They needed to know what you were sending, and you couldn't just put things on an airplane. And I mean, I was freaking out. So we kind of found some backwoods ways to get supplies. I think I packed everything in 40 minutes. My adrenaline was rushing, and I thought, what if I don't have the right stuff? It was crazy. Got a car to drive to Jacksonville, a private plane to fly and land in Wharton. Diabetes educator team met the plane and drove and then boated in. And it's just some amazing story. And, it was within, 12 hours, however many hours it was from getting the call to supplies being in the boat, rescuing people. And I'm thinking, that's cool. That is amazing. It doesn't always happen quite that dramatically, but I just felt like that was such a moment. The DDRC is an amazing, as I say, CWD is one of the new, all these groups together so that we speak in the same voice. And there's not different messages coming from different places, and really help to educate people. And I'll say, we come in and provide supplies as needed, but I can't stress enough preparedness on people's part, having what they need, having an emergency plan. Tornadoes don't come with warning, and we always hear that, you kind of find out after the case. Everyone needs a plan. Everyone needs a go kit. Be prepared. You just, in this day and age, we don't know what's going to happen and when, and it's really best to be prepared.
That is such an understatement. Yes, we really don't. So I'm glad that you mentioned making sure people have a go bag, an emergency plan, knowing what steps to take if some sort of disaster were to strike. That's really important. So thanks for highlighting that. I don't know if this is a question you'll like, because it puts a little pressure on the future state of things, but I wanted to know what the Insulin for Life plan was for the mission in the next year, and maybe what that looks like in the next 10 years. And I know that there's been a weird reset for a lot of different organizations as COVID rolled through and changed so much of what we do. But as the world is starting to return to some semblance of normal, and we're hoping to continue on that path, what do you see next for your organization in the short term and then the long term?
Perfect. Well, thanks for that question, Carrie. We're always forward looking, right? That's how to build a successful place. And, I think I would answer that by coming backward and saying, as the pandemic rolled in and the country was shutting down, I was gripped with fear. If you want to know the truth, will our donations dry up? Are people going to hold on to what they have? I certainly keep reserves in place, but they won't last for, none of us knew how long would this lockdown happen. And I can't lock down, we have to be open. We still get people calling or emailing. Are you still accepting things? I'm proud to say we never closed.
Mm-hmm.
We encouraged our staff to be super careful because we needed to be operating. We needed to be able to continue shipping. People's lives dependent on us to be successful. We were approached by a funder and Abbott, who donated Freestyle Libre. When you ask about that, those were the sensors we send out: 30,000 to hospitals, 25,000 to clinics. So they all came and said, "We'll donate. Can you be our arms and our legs? Can you make this happen? Can you get this out?" And my answer was yes. And then I said to our staff, okay, everyone has to stay healthy. I can't do this alone.
Mm-hmm.
So we really have had an amazingly busy year. While I hear other people slowing down, I feel like we doubled our efforts. We maintained our international program and launched a whole new domestic program. Worst kept secret, that was what was next for us, is really solidifying some good relationships with clinics who served people in need, who maybe, I would say if you can get people on a pump, we can get them the supplies. I tend to call them accessories because I'm a girl and we know what accessories are, right? But supplies, whether that is to keep you in your therapy, we can help with that. So that's kind of our short term, is to continue, not only continue, but increase. And to do that, we need people to donate those supplies, donate those sensors. It's been exciting through the pandemic, and that may sound a little twisted, but some of the feedback we've gotten about, wow, these sensors have just transformed people who couldn't have them before, are on CGM, and really relating to what they eat and their exercise to their blood levels, and really getting a handle on better management. So these are opportunities that, weren't available to them before. So we want to continue to increase our domestic presence, not at the expense of our international work. It's kind of like as a parent, when you say, which child do you love more? Yes, both. We love our international work. We love our domestic work. We love our disaster work. We want all of it to thrive. So just continuing to grow in whatever way that looks, and just be in more places and providing more supplies as our donations allow us. I think that's what I want your listeners to hear. We can only distribute what's donated. So we are totally dependent on the diabetes community coming around, and we all know this is a tight-knit community that takes care of itself. And we're just honored to be a part of that.
Well, I love that. And as a member of the type 1 diabetes community for like a super long time, it'll be 35 years in September. I know that this community knows how to pull together and take care of one another. And it's really nice to hear what your organization is doing to help get things to people who need them. So as a reminder for the folks at home, the Insulin for Life website is iflusa.org, right, Carol?
That's it.
Okay, and they can find all your
job.
social, thank you. And they can find all the social media connections at the bottom of the website. And so they'll be able to connect with you all however they can. But what I really want people to be clicking on is that contact form and to either make the donations that you can or find out ways that you can donate your time and your resources to help grow this organization, because it's really, really important. And as someone who wants to see the community grow and continue to thrive, this is really, really crucial. So Carol, thank you for being with us this morning and giving this Screenside Chat a second go. Is there anything else that you'd want to add for the community before we sign off?
I think you've heard my be prepared message, and I'll just throw that in one more time. You know, besides helping us keep people safe and supplied, keep yourself safe and supplied. So thank you all so much for, again, when I say Insulin for Life has been successful and grown, we're just the recipients, you know, we're the connector. Thank you for allowing us to be the connector in this important community. We're here to help. We're here to, you know, come alongside, and no one wants to throw away vital resources. So I hope you see it as such a wonderful opportunity. If you're blessed with excess, you know, whether for whatever reason that may be, pass that along. Don't, you know, on our first slide, it was donate, don't destroy. That's the message today. If you have something viable, don't hang on till it's expired and throw it away. Donate that to someone else, not at your own peril. We want you to be safe and have what you need. That's certainly primary and important. But let's not waste resources. So if you have supplies, take a good, honest look at what you have and what you can use, and what you can't use, share.
Well, Carol, that is so important. And thank you for making us close with that. I appreciate that. And our community benefits from hearing your stories. And so this video will be available for people to rewatch. So if they need to catch some of the info from the presentation at the beginning, they can just wait for the video to be posted later today, and we'll have that live and you guys can check that out. Feel free to share it to folks that you know would want to hear about this organization, who would benefit from hearing about Insulin for Life. And Carol, thank you very much for joining us today. I really appreciate it.
Well, thank you so much. We are so grateful to be on here and to join with you. It's been a real honor. Thank you.
Thank you. And for folks at home, the next Screenside Chat will be on June 6th. We're taking Memorial Day weekend off, so that we'll reconvene on June 6th, which is a Sunday, and we'll be talking with Svati Narula, who is a person with diabetes who survived the April 2015 avalanche at Mount Everest. So you won't want to miss that one either. Hope to see you all then. And in the meantime, stay safe, and we will talk to you soon. Bye.
Bye. Thanks, everyone.